60% of the people got either a fracture or a bullet on their bodies.
60% of the people?
Yeah, in this area. This place was affected by the war many times.
It's 6,000 miles from West Michigan, stricken with disease and has one of the highest infant mortality rates in the world. When people in South Sudan get sick, they traditionally turn to witch doctors and prayer. But a West Michigan charity is helping to change that.
Fox 17's Cassandra Arsenal traveled to that country and got to see the charity's efforts firsthand. She's live with more. Cassie?
Christian Janus has called Partners in Compassionate Care, and they're right here in West Michigan. They helped build a hospital in South Sudan in 2006 with only 12 beds, now 28 beds. And despite war and aggression, they're still making a difference in one of the most remote regions of the world. A 1.5-year-old baby, barely holding on, brought into the hospital dehydrated just moments from death. Another fighting malaria. It's a common scene, patients waiting for hours for medication outside the pharmacy, even receiving vaccines on the spot.
Yeah, today is busy, but it's not busy like it's like Monday and Tuesday. These are the busiest day. Yeah, this is a low day.
Michael McGuett is the administrator of Memorial Christian Hospital, and he has his hands full.
This country was affected terribly by the war. And you can tell now people need a lot of things.
Beds are left empty after their village was burned and people killed or chased out a year ago.
Because of the insecurity, people are afraid if they come here and get operated, something happen, they may not manage to escape.
The hospital has few resources. It runs on a generator.
But
What's that?
its power is off.
The power turns off? Okay, there we go.
Power's only turned on when surgeries are scheduled.
Did I tire too much?
No.
We got exclusive access to the hospital, going behind closed doors into surgery. Dr. Guy has been practicing medicine in South Sudan for 35 years. He has 2 surgeries scheduled this day.
Now she had been complaining and she is troubling the whole family.
The first, a woman with chronic pain. Dr. Guy thinks it's appendicitis and is quick to operate. American doctors observe and have a few questions.
Are we certain it's an appendix or is it something different perhaps?
Dr. Pam Oger, who's been in hospitals all over the world, says in America, multiple tests and exams would be conducted and surgery would be a last option.
It's a very tedious, very complex problem.
Here, that's not realistic. There's no way to conduct tests like MRIs.
I don't agree with it.
Okay.
I don't agree with it. But if I don't do it, they will go and seek a traditional medicine.
Oh, then they will die.
Traditional medicine from a witch doctor, and most patients who see one are at risk of dying.
We don't have the problem of people going to a witch doctor if the doctor won't do the surgery. And a witch doctor using a nail is that's not preferable.
A problem that's been around for decades. Deng Jun Kuch, a lost boy, recalls how he would be treated when he was sick.
I remember when I got sick, my grandfather used to come to me and stretch my arm like this, make that, and then tack, and blow into my nose, and then say I will be okay.
They find an ovarian cyst during surgery that is safely removed, and the dehydrated baby recovering after he's given an IV. As you can see, there's patients here recovering. Most of these beds used to be full, but since the war, there's not as many patients coming. But what's interesting about this hospital is that in America, we don't have to have family members with us when we're having surgery. Here, it's a requirement. You can't get surgery if you don't have a family member to take care of you. And if you take a look out here, the family members don't leave. They stay here the entire time until their relative, cousins, aunt, whoever they're taking care of is completely healed. American doctors are impressed by how well equipped the hospital is.
What I see here are I see hospital beds. I saw, see something like an ultrasound, IV poles and IVs. The pharmacy is better stocked. There's also the ability to do surgery here.
The hospital is restoring this broken community.
So this woman, her husband abandoned her for those 10 years with her daughter because she couldn't give birth.
With services not possible before, this ultrasound machine donated by Spectrum Health was able to detect a tumor.
A fibroid tumor in her uterus for almost 10 years. It was like this.
Now she's able to have children.
Oh, she lived after this, there's no complication. She went home, she was so excited.
In these 2 crates is the x-ray machine that Spectrum Health donated to MCH. It's finally arrived. It's going to benefit 1.4 million people, the only x-ray machine in the country.
In this area, maybe 60% of the people got either a fracture or a bullet on their bodies.
60% of the people?
Yeah, in this area. This place was affected by the war many times.
The hospital is serving over 65,000 patients and over 2,000 surgeries, with each procedure a chance to live. They're making huge strides. Now tomorrow, Partners in Compassionate Care will talk to South Sudan's leaders as well as the villages about their plans for their future and how they want to help to build them back up. For now, Cassandra Arsenault, Fox 17 News.
All right, another great report, Cassie. Thanks for